morning, ma'am. I am Judith Ramos, and today we will be doing the student newborn care, and we will start now. Ire! Okay, so now that the baby is out, I will be calling out the time of birth, sex of the newborn, and attach the identification band. So, ayan na, mami, lumabas ng iyong baby ng 1:30 a.m. And it's a baby girl! Congratulations, mami! Ayan, I will put it na here. And I will put the identification card. So, isa po, the name ng mami. Ayan, si mami. Tapos, hospital number niya, and date of birth, and the time is already here. Sa kanya, identification band. Pupunasan na din natin siya. Ayan, mga. Okay, we will now be wiping the newborn thoroughly to prevent hypothermia. So, ayan. The rationale for number 1 is newborn identification is an important nursing responsibility, and nurses must be certain that the infant has an identification band in place so medicine administration or performing procedures can be done safely. So we had 2 identifiers, a number that corresponds to the mother's hospital number, mother's name, sex, date, and time of the infant's birth are printed on the band, and 2 bands should be used and attached to the infant's arms or legs because hands can slide off easily. And ayun, while delivering onto mother's abdomen or into her arms while assessing the infant's outcry score at 1 minute, 5 minute, 1 minute or 5 minutes, and 10 minutes if response is poor after birth. So, ina-assess ko ang aking baby, right? So I could see that there is no cyanosis. There is more than 100 beats per minute. Responds promptly with a cry. Yeah. Okay. Good flexion and good vigorous cry nga si baby. So, the score is 10. Congrats. Rapid cardiopulmonary adoption, and if UPGAR score is 8 or higher, no intervention is needed. If an infant is obviously in distress, interventions to correct the problem are instituted immediately rather than waiting for the 1-minute UPGAR score. And as I did a while ago, I have immediate thorough drying with a dry warm cloth. Ayan. So, thorough din ulit natin. And let us dispose the wet linen. Bonnet. And apart from protection from cold, stress, and hypothermia, and drying stimulates breathing, and it should be the immediate action for all newborns regardless of gestational age or birth weight, and the head should be dried well. Na-dry na natin. And because substantial heat loss can occur from the head, which is about 1/4 of the neonate's body surface area. And I have also, si baby, naka-skin to skin kay mommy. And generally perceived to be an intervention for provision of warmth and bonding. Less well appreciated are its contribution to immunoprotection of the newborn and protection from hypoglycemia. Now, it's time to do the proper cord clamp and cutting once pulsation stops within 1 to 3 minutes. And delayed cord clamping increases the infant's blood volume and iron reserves and reduces the incidence of iron deficiency anemia in infancy. So ayun, we should not milk the umbilical cord towards the infant. So there's no milking. Okay, and now we will be clamping. So assuming that this is 5 cm apart from the base, assuming lang natin yan na 5. And 2 cm with sterile cord clamp at near the infant. 2 cm to Hindi kita, pero 2 cm yan. Ayan. So, no milking because when the umbilical cord is forced into the baby's abdomen, the pressure can cause tiny blood vessels into the brain to rupture, increasing the risk of severe intraventricular hemorrhage or bleeding into the brain's fluid-filled cavities. And now we will cut. Pretend this is the Band-Aid scissors. Yes. And we will be cutting it close to the first clamp, which is this one. Ayun na nga, nag-cut na. And it is recommended that the clamping of the umbilical cord is done at least 5 centimeters from the abdominal wall. Ayun. And if the umbilical cord is as broad base, it is also recommended to clamp at a safe distance from the base is premature. Infants should be clamped longer than the recommended distance from the possibility of umbilical cauterization. And we shall not apply anything onto the cord stump, such as alcohol, because keeping the cord stump dry is the best way to promote healthy healing and a natural break off. Alcohol should be avoided for the antibacterial effect of alcohol is brief and can be harmful to the baby, and it can also delay the usual 7 to 14 days of cord drying and separation by a day or two. Now I will be examining the number of blood vessels into the umbilical cord. So we could see that there are 2 arteries and 1 vein. Pero yun, 2 arteries and 1 vein. A single umbilical artery requires research for congenital malformations, and in some reports, a significant number of these infants have congenital anomalies, particularly renal and gastrointestinal malformations. Okay, so let the student actual to deliver the placenta. Okay, deliver ng placenta. Okay. Hindi yan kasama sa checklist. Cool. So, now I will be promoting non-separation of newborn from the mother for initiating of breastfeeding. So, mommy, now that the baby is delivered, pwede na po kayo mag-breastfeed sa inyong anak, kasi baby girl. Yeah, and the benefits of breastfeeding for the health and well-being of the mother, which is ikaw po, mommy, and sa iyong baby are well documented for WHO recommends initiation of breastfeeding within an hour after delivery, and this may reduce neonatal mortality by decreasing the ingestion of infectious pathogens. Okay, now after completion of the first breastfeeding, I will now be performing first complete physical examination. So, let us examine the eyes, nose. Okay, walang cleft lip, no jaundice, no early signs of jaundice, walang abdominal distension. Okay, immediately after birth, the nurse performs assessment that are most immediately crucial to determining the neonate's health status, and this includes cardiorespiratory status, thermoregulation, and the presence of anomalies. So, wala naman. Everything's fine. Everything's not serious. Or yun. Okay. And the nurse determines whether resuscitation or other immediate interventions are necessary. So there is nothing that necessary. Okay. Okay. And when the infant is stable and oxygenating well, a more thorough assessment can be performed, and this is also done to evaluate the newborns for maturity and general well-being. So as you can see, yeah, okay. And now I will be taking the anthropometrics measurements, which includes the weight, height, head circumference, chest, and abdominal circumference. Vital statistics of the newborn are important determinants used to confirm if the newborn is healthy. Next, I will be performing eye care with erythromycin ophthalmic ointment, assuming that it is this one, pero assume lang natin, on both eyes from the inner to the outer canthus, and apply 1 ribbon cm on both eyes. So, inner to outer, inner to outer, yun. And this helps to prevent ophthalmia neonatorum in infants of mothers infected with gonorrhea and conjunctivitis for treatment of any eye infection. Next, I will be injecting vitamin K, which is 1 mg on the vastus lateralis. Yan, vitamin K, 1 mg. And even in preterms, left anterolateral thigh, so the vastus lateralis. So for the vitamin K, it is on the left side of the baby. So andito po siya, banda. Since plastic po ang ating baby, we will be injecting it in an orange. So dito po siya. Discard in the safety, IM injection in the vastus lateralis of the newborn. Clean. Discard. IM. Hold. Push. Don't forget to aspirate first before putting the injection. And before injecting it. Discard it safely in the bottle. So yun na. And apply pressure. Next injection, and vitamin K prevents and treats hemorrhagic disease in newborns. And next, I will be injecting hepatitis B vaccine, and that is 0.5 on the right anterolateral thigh, which is here naman ng baby, right vastus lateralis of the baby. That will be placed here. Yan. But since our baby nga is plastic, I will be injecting it. Discard. Clean. Aspirate. Inject. Apply pressure. Fine. Discard. Okay. And the hepatitis B is for the immunization against infection caused by all known subtypes of hepatitis B virus. And lastly, I will be injecting the BCG vaccine. Last na natin. Yan. With a 0.05. And this will be done ID on the left deltoid. So, assuming it is here of the infant, but since it is plastic na, ayan, ID. Clean. Yan. Ito yung bulb. Yan, there should be a bulb. Inject. Yan. Hindi na po mag-apply ng pressure or anything here. So the BCG is to prevent severe TB in infants because the neonatal immune system is still immature, and this protects the newborns from serious forms of TB such as TB meningitis and infection of the brain and malaria TB, which is a widespread infection. So next, I will be taking the newborn's initial vital signs to obtain an accurate baseline measurement, and vital signs measurements begin to change from those present in intrauterine life and at the moment of birth. And so there is more than 100 beats per minute, and the respiratory rate is there, and ganyan. The temperature is 36.7. Okay, so after the physical examination, I will now be rooming in with the mother. And rooming in allows the mother to develop confidence in caring for a newborn, and it allows the mother to read the baby's cues to know if the infant is sleeping or hungry. And this is a huge help when the mother leaves the hospital. Sorry, Mama. Honey. Hello. Okay, and I will now be explaining all the measurements. And say naman sa baby. Yan, mami. Sige ang inyong baby. Tapos na po ako sa physical examination niya. And I have already checked for... No. Now, sa physical, niya. Tapos na ako, mami, sa physical examinations niya. And okay naman po ang kanyang abdominal distensions, yung upper limbs niya, ang kaniyang face, wala naman cleft lip or anything. So, ayun po. And for that, I've also taken the anthropometric measurements, mami. Ang kaniyang head circumference po ay nasa 33 cm. Ang kaniyang chest and abdomen po ay nasa 31 cm. And ang kaniyang leg ay nasa 54 cm. And ang kanyang weight ay nasa 400,000 grams. And this helps explanation lessens the anxiety, ayun na nga, and thus promoting cooperation. And I will keep with mother in skin-to-skin contact and covered with warm blanket and bonnet hat. So ayun na nga, I gave the baby with the mommy, and naka-skin to skin po sila, at may bonnet na din po si ating baby. And this enables colonization of the newborn to maternal flora versus hospital flora to protect against infection and promotes breastfeeding. And this prevents hypothermia and stimulates hormones to support breastfeeding and monitoring. Now, I will be keeping the newborn's temperature between 36.5 to 37.5. So, ito lang po ang ating thermometer right now. So, mommy, let me just check the temperature of your baby. Okay. So, ang temperature po ng ating baby ay 36.7. So, this temperature will fall almost immediately to below normal. And because of heat loss, the temperature of the birthing homes and the infant's immature temperature regulating mechanisms if the baby is not protected from heat loss at birth and in the moments afterwards. Hypothermia raises the infant's metabolic rate and oxygen consumption, worsening any respiratory problems. Now, I will be postponing that bathing until after 24 hours of life and no earlier than 6 hours of life. So, mami, ang ating baby po, hindi po siya pwede agad-agad. Kailangan po after 24 hours and no longer than 6 hours. Don't cry. So, ayun po, mami, ha? We will bathe the baby later after 24 hours. And bathing the newborn immediately after birth predisposes disposes him or her to developing hypothermia. And when hypothermia sets in, there is an increased risk of infection, coagulation defects, acidosis, delayed fetal to newborn circulatory adjustment, hyaline membrane disease, and intracranial hemorrhages. And baiting also washes away the vernix caseosa, which has been shown in several studies to have antimicrobial properties similar to that of amniotic fluid and breast milk. I will also be minimizing the handling of the newborn. Minimize. Ayan. For healthcare workers and family members caring of the newborn should thoroughly wash their hands and arms to the elbows with an antiseptic soap before handling infants. And this prevents reduces transmission of infection. So, Mami, pag may gusto humawak po sa ating baby, please be reminded that we should always perform proper hand hygiene po. Okay. Next is I will watch out for difficulty of breathing, early jaundice, or feeding difficulties. So, kung saan po ating baby, nahirapan po ba breastfeed? Ganun po ba? Okay. So, there's no color, hindi po siya may jaundice or anything. Okay, so ayun. Wala naman po difficulty of breathing ng ating baby. Okay, so any abnormal observation should be referred to the primary care provider, attending physician, or immediate care and management of the newborn. So if there is, tatawagin ko na po si Doc. Ayan. And lastly, I will record all assessments and newborn therapeutics given and other measurements done in the patient's chart. So, ayan. Magre-record na ako. So, kung nagre-record ako na. So, ayun nga. Score! Upguard 10. Delivered. Kaninang 1:30 a.m. Baby girl. Wow, very nice. No difficulty of breathing. No jaundice. No feeding difficulties. So the rationale for this is that the infant's chart is also a vital piece of documentation because it serves as a baseline for the infant's health status and it provides information of all measurements done to the newborn. And it should also contain birth record documentation. Thank you, Mom. God bless. And congrats po sa ating newborn baby. If you need me, call me. So, rest na po kayo.